Okay, welcome back everybody to this exciting patient people living with MJD section of the program. What we'd like to do just for the next section is to introduce our panel of people to you, and they're going to take the opportunity to spend 2 or 3 minutes each just telling you a little bit about themselves and what's important to them about being here. Then we'll have the opportunity for our panel to ask the researchers some questions based on the sorts of things that they've been listening to and have developed questions about over the course of the meeting. And then the final part of the program will be questions that are coming from the researchers to the panel, and you'll see some of those questions that we've collected in the Menti poll and the Google poll prior to the meeting. So we are passing microphones around a little bit, so I'm going to pass this back and ask the panel to introduce themselves, if that's okay.
Hello. My name is Terrence Parker. I guess I need to introduce myself, say something that I want to get out of this. Basically, the reason why I'm here is to see where MJD is going, see if there's any progress that's been made. My name is Terrence Parker. Just like I said, I'm a program analyst. I'm working right now for the federal government. In my past life, I was a Marine. I was a major of Marines, and that was before this disease kicked in. And I made it up to 8th degree black belt. I'm a grandmaster. So it's easy to say that this disease has greatly affected me, but I'm not down on myself. I'm still trying to progress and move on. In about 2 or 3 months, I should be awarded my doctorate degree. So I'm still trying to strive and move forward.
Hello, my name is Francisco. I am Portuguese myself, and from the past 10 years I've been diagnosed with Machado disease. As we say in England, it's hard because now I do live in England. It's very difficult for us to say spina cerebellar type 3 ataxia. So it's a very long term. I have got a degree in French and Spanish philology. I have a PhD. The sides of that the part of my disease came from my mother's side of the family. I do have also a sister, but she just got the gene. Sorry. Okay. And that's pretty much it, actually. Thank you. And the reason I'm in here is to make proud of myself, saying that I am still here fighting for this condition. There is hope. Thank you.
Hello, my name is Brian. I have my background is in health. I used to work in HIV prevention, and specifically with gay men. many years ago, I organised a conference, which was the first in the UK ever, to start bringing healthcare professionals, scientists, researchers together to share information and collaborate. And in this room now, I know is a lot of hope. There's also the answer. So we'd like to say thank you for all your hard work, for all the presentations, and for all the hard work that you're putting in, because the efforts I know from that experience pays off. So thank you on that side. My interest here is that I met this young man here in 1994. We lost contact, but through the internet, we met again in 2014, and we were married this year. My husband has run 7 marathons across the world. He's a marathon runner, and my promise to him was that I would ensure that his quality of life would be the best I could possibly make it. We're not funded by anybody, we're self-funding, but we will go anywhere to listen to good practice, the experts, but also I know that things can change very quickly. So anything that provides us with a good quality of life, or even access to trials that we don't know about, it's worth traveling or getting on a plane and finding out. That's why we're here. But I also have my own health issues. I've experienced many brain infections myself. I've had meningitis and 4 episodes of encephalitis. So my understandings of how to, what it takes an individual to try and come to terms with the impact of those neurological things. I have a very personal experience of that. So thank you all for inviting us here. And that's us.
Hi everyone, my name's Jen. I'm a physio and a researcher. I work with Joyce and Guy and we're doing research on MJD. I'm just here today sitting with these ladies, just supporting them on this panel. So I'm just going to fade into the background a little bit and I'll hand you to Guy.
My name is Kayang Lara and come from Australia, Rhode Island, and going to share about the disease that my family's had. We didn't know about this disease, but I live in the clinic. But we used to help each other as a family. Every day I used to go to my sisters and 2 girls, my nieces, that I used to help them because we never asked outside people to come and help us, because it brought us shame that we never talk about that disease with other people, just us as a family. But I myself didn't know about it too. And I kept on helping them because it doesn't matter that I didn't understand about this disease, this MJD, Machado Joseph disease, but just the same that I worked and helped them because I wanted to let my people to get better education so they could move around and do things for themselves. But I never treated them as a disabled people. I treated them as a normal person like me. Because my sisters, all of my sisters and brothers had this disease. I never went and asked them, but they themselves came and told me that they were sick and not walking properly. It started with walking wobbly or even zigzag when they were walking. And even my brothers, but still, it was so painful for me to see my own families going through this disease. But still, I wanted to help them. Then about the research that I was helping Jen and Joyce, so they could understand the things that we were doing in research. So for myself, so I could understand properly, so I could explain to my families, my clients. And some of them that used to ask me a lot of questions, and I used to say, I don't know. Then in 2008, that's the time that John Macmillan came and told us about this disease in Cambodia. And a lot of my clients, my sister, brothers, some of them were there, but some already have gone. And I'm the only one that left from my families. But I stood strong, not for myself, for my family's sake. I wanted them to get proper treatment, get things that they wanted to move around, like frame, walking frame, and even the wheelchair. I wanted them and to know about this disease that we never knew about it. But today, when I heard that they were in other countries that they had this disease, Machado Joseph disease, I was so relieved from the burdens that I had, shame, everything just went out from me. And I felt much happier, so I could go about doing things with my families or even share what my families were going through. And today, I'm proud. I was working not for money. I worked so hard for my family's sake. I wanted them to have better help, and that's what I was looking for. But today, I'm a proud person now to look, and everything that they need, access in the houses, they've got that. And I'm proud of them. Thank you.
Hello, my name is Joyce Lara, and I just want to tell you what's from the start. I had this sickness, MJD, when me and my friends went to the walk down the river, they saw me walking. I was walking like wobbling. Then they told me, but I said, they said to me, you walk straight. They said, hey, I'm not. And I said to them, I'm walking straight. What's wrong with me? you wobbling, they said. Well, then from there, after Ripa, I went back home. Then I didn't know I had this MJD.
That's when it started.
That's when it started. Did you want to say anything else?
No? Okay.
Thank you very much. Okay, thank you. Thank you very much to our panel. Now is actually an opportunity for them to ask some questions of the researchers in the room, and I know some of the panel members have given this quite a bit of thought. So it's quite a confronting and difficult thing to do, so we'll have some patience if it takes some time to do that, but we'll just pass the microphone back, Jen, and see who's brave enough to ask a question first.
Kick us off, Brian. You go for it, mate.
Yeah. I would like to know what interventions now would the conference endorse for someone living with spinal cerebellar ataxia type 3 that would improve coordination, mobility and speech, or other interventions that would improve the quality of life. Although we're aware of the physical and the coordination, but in terms of any other interventions, especially any pharmacological ones or any other therapies that they would endorse now.
So just to repeat the question, if I understood it correctly, is that what types of interventions might be available now to help with symptom management as well as quality of life? So if there's anyone here in the room that may be able to speak to that.
One of the reasons why I asked this question is that my husband had never, met anybody with his condition, but during our honeymoon, we were on a cruise ship and off Mexico, I think it was, and we met somebody on board ship who had exactly the same condition as he did, and it was the first time ever that he had met somebody, despite living in London, with the same condition. She was an American, she's a triathlete, so there was a connection there, but she had undergone a gene therapy that, for us, we had never heard that was actually even accessible, or what. And so it becomes a little bit confusing and clouding for us to try and understand what therapies are out there. And what's accessible for us. Because to be honest, I'm living with my husband and we do want to try and improve the quality of life by not by false hope or interventions that are going to impact in a negative way, but obviously to improve the quality of life. What would you do? You'd want the answers now. And if the drug companies are here or listening, open up your pockets a little bit deeper, because funding needs time, it needs researchers, and it needs money, and it needs resources. There are people that are being affected now, and there are people that are living with this condition now. And much like the HIV crisis, people were dying and they were being impacted now. We need them to open up their pockets. They've got the pockets, whether it's governments or wherever. Those are the people with the power, the money. They need to start opening and loosening those pockets, because without that, We are stuck. And I'm not going to sit here. Well, I know that those resources can be open. So my appeal now is to say to those people with the power, and it's usually the drug companies, but also the governments, the other institutions that have got those purses, open up your pockets a little bit deeper, and especially the drug companies, because those pockets they've got a lot of money there. Open them up a little bit wider, because people are being affected now. We can see how big the cohort is across the world. Come on. That's my appeal to you. But in the meantime, I would say, if anyone's got any positive interventions that they could assist with or guide us to, we'd be very grateful.
Do we have anyone from the floor who has got any kind of response to that in terms of practical things that can be done now, or therapies that are available that the panel might be able to hear about? In layman's terms, I guess, is what we're saying.
Please don't be shy. We know there are many clinicians in the room who all counsel patients, and the advice you might give them. And if anyone who's here from industry feels comfortable to maybe talk about the strategic plans that your organizations have and looking forward about future trials.
I think, and even some of the challenges, if that's appropriate, some explanation of why some things are difficult to achieve in this space.
Rebecca, did you want to say something? Yeah, that would be great.
I'm a speech pathologist and I'm pretty new to this MJD space myself, really, but have been working in the field of augmentative and alternative communication for a number of years. And to my knowledge, in terms of things that can be done now to support speech and communication, there's potential that some voice exercises might help to keep a strong, loud voice for up to a couple of years. And then there are also some voice banking and a number of AAC devices that can be used now while speech is still strong. There are some really amazing developments happening in machine learning and speech synthesis in terms of personalized voices, which is very exciting and is happening now, but is still quite new. But there's definitely a lot of things to consider now in terms of voice banking and capturing that while speech is still strong, so that potentially for a future where you lose a lot of volume or find speech difficult to understand, that you have that personalized voice and messages that you can use on an alternative communication device.
Thank you.
Thank you.
Thank you, Rebecca, and thank you for helping to warm up the space a little bit.
From the point you can understand there is nothing to do at the moment, no drugs. And what I presented yesterday is a plan, a program for MJD patients for the diet, exercise, sleep management. You saw it. And this is a suggestion, and this is I think, a very good one, that might target the disease mechanisms and might slow down the symptoms, even relatively, not in the beginning stage. So we should try this. I think this is the best we can do.
Thank you.
And I might just jump in there too. The research that we've been doing together, like we've been talking about, and very in line with what you're doing as well. It's about lifestyle. It's about keeping moving and having an active lifestyle. It's not just about physical activity, but it's the lifestyle as well. At the heart of what the research we've been doing is, if you want to keep walking and moving around as long as you can, then you have to keep yourself strong on the outside and on the inside. Staying strong on the outside in your arms, your legs and your muscles. Staying strong on the inside in your mind and your heart and your spirit. And to do that, you've got to do what really matters to you and find the things that are most important to you to do. And part of that is looking after yourself and keeping active and living a healthy lifestyle, but keeping yourself moving and surrounding yourself with people who are important to you as well. I'm trying to think what else I was going to say about that, but I think really that's the best medicine we have currently, is to keep yourself moving as long as you can, in whatever way you can, but in ways that are most important to you and ways that make you happy.
Thank you.
No worries.
I am a neurologist by background. I manage an Ataxia clinic in Lima, Peru, in South America. And from our perspective, from our experience, I'm going to comment to you only 3 aspects. Probably Laura will convey those ideas, but I think the very first thing we try to do with patients and families is try to explain as much as we can the disease. Because one of the main things that we really understand from patients and families is that not be aware and don't have information or enough clear information about the disorder is the source of many other difficulties in the future. So that's, I mean, invest a lot of time in that important issue. So after that, we have to recognize that there are no effective treatment, at least today. Who knows tomorrow or the day after? But at least today, we do not have that, and it's important also to discuss that with patients and families. And the other 2 things I think it's important is manage, for example, depression. When the patient start with this disorder or have this disorder, it's really hard for he or she to accept this new situation, and so it's very common to have these symptoms, depression. They feel pretty sad and so on. So it's important to recognize those symptoms because we can treat them. And at the end, I just want to comment on, we have to keep in mind that as any other person, we also can have other conditions. So if the person have this inherited disorder, well, the first thing is to accept that, but to take care of ourselves, do not have other things, right? Or if we have, for example, hypertension or diabetes or other issues, we have to control them as best as possible. That will help a lot.
I would just like to shift a little bit to a positive note. So I think you've seen during this day and a half that basically we actually live exciting moments in terms of finding new therapies. So if some years ago you would not have seen all these different approaches that we know are very promising because they were effective in the animal models that we tested. Of course, some of these may fail in clinical trials, but still there is a reasonable reason to be confident that some of these approaches will work. And also, I think we should be aware that some of these approaches will be expensive, of course. But today, if you look around, we see people from different companies that are here in this meeting. And this is actually a fantastic sign. They are interested, they believe that the technologies that we developed over the last years will work and will be effective and will alleviate the disease and will even eventually cure the disease. So I think we should have a positive view on this. We have never had such a good moment as we have now. Yeah, that's what I would like to leave this note.
Well, I couldn't agree more with my SEDs, but I would like also to add some thoughts to relativism. I don't know, relativism. How should I say it in English? They're relative things. This experience that we have in this half one and half day. This is a scientific meeting. All of you here are focused or biased towards looking for disease modifier treatment. However, there are other kind of treatments related to symptoms. So if you are receiving an intervention or therapy or whatever for anything like that, for instance, if you have a flu, you will receive only symptomatic treatment, and that's okay for you because it improves it reduces your suffering, improves your quality of life. What is happening here is that we have facing quite a few clinical trials on symptomatic treatments for ataxia symptoms. Definitely, that's true. Yeah? So maybe it was understated in some of my last slides, this assumption that all researchers, at least clinical researchers from the neurology field, should also put some efforts in performing clinical trials for symptomatic treatments. Why that? Because there's no other way for us to work than to look for evidence-based and qualified forms of treating subjects. So we need to have evidence-based data to propose to our patients what symptomatic treatments should be. But definitely rehabilitation, speech therapy, physical therapy improves a lot patients affected with any kind of attack. So this is my own experience, but I have never measured this. I did it once with occupational therapy, I remember. Okay, so, but it was just once, because of course we are more concerned with those disease modifier scenarios. Because we want to find a cure, as you also want that. But if you look for other degenerative or neurodegenerative disorders, I mean, what is the main difference in between Parkinson's and spinal cerebral ataxia? Is that we know a symptomatic therapy, very efficient symptomatic therapy that is L-DOPA, but it will be good for a period of life of these subjects. Unfortunately, we didn't find any drug, symptomatic drug against the ataxia up to now, but we have physical therapy, so we need to put some efforts as well into that. So when you come to those scientific meetings, maybe you feel you can finish the meeting with this feeling that it will take a long, and it will take some time for us to prove efficacy for disease modifying therapy. But also, we are not as related as we should do with symptomatic therapy. So this is a criticism for the community, for the scientific community as well. And I agree with you that we need to do a lot of things for improved quality of life now. Because people are living now, and you have a lot of value, you have a lot of things to do. And to finish the story, I really agree with Milo when he says that information is the best thing that we can give to families and people related to Machado affected subjects as well. From my experience, after the discovery of the gene and the development of molecular studies and diagnosis, subjects, the affected individuals, improve it because they have now an explanation, a concrete explanation of what is going on with them, instead of thinking about curses and so such a thing, so this familial stories of who is in guilt of that, or that there is no guilt in the relationship with this. So just for having this information, patients and subject and families have therapeutic effects on their own lives. Just knowing that. I hope that you can help a little bit more, and maybe also needs to be what should be true for you.
Thank you. I think that's an important perspective that we're here to discuss, trying to find a treatment and a cure, but currently we do know that there are things to help with sleep problems, pain, depression. Most of the symptoms that people have with MJD, we have treatments to help with those symptoms currently. I think Mr. Parker has a question.
Actually, my question was pretty much answered. Well, it wasn't answered, but it was addressed. And my question was dealing with information. I was wondering, does the community know any information on the history of MJD? Because for me, I've been with it for 8 years, and I know that my information that I got is probably incorrect. And before I got my information, the generation before me who had the disease didn't know anything about it. And I know it came from my grandfather, and they said that he got struck by lightning. So, he got struck by lightning, and now I have MJD. So if anybody can, point me towards the right direction of if there's a book or something written down, because I'm a connoisseur of information, just to point me to the right direction so I can get some right information.
Maybe Libby, if you want to answer that. Dr. Shakilios is not here, but certainly explore MJD.
Yeah, I guess there is quite a lot of information about the history of the disease around the world, and there have been a few presentations over the last day and a half that have looked into not just the lived experience but the scientific history of the disease, how it has been spread around the world, how it's different, slightly different in other places. So we can certainly get some of that information to you, and I think one of the messages to us is to package that information in a way that is accessible to people who are living with the disease and is useful to them. And in the same way as the questions about how can my life be improved living with MJD in terms of what are the therapeutics available, the quality of life research I think is a really important take-home message. And it was very similar 2 years ago in Italy at the Ataxia conference. The patients there said very similar things. The research that they were interested in was about the lives that they were living, as well as the information about the cures. So I think that's a really consistent message. I think, does anyone else have any other questions they want to ask the room, or we can have a look at some of the questions that the meeting have actually come up with for our panel.
Go on with the question. It's a good question. I just have one question to ask those people that are doing this research. Why are you doing this for? Doing this research to help people like MJD people? Or are you just studying or doing this for yourself so you could know? That's my question. Thank you.
Thank you, Gayama. So what are the personal motivations of those of you who are here researching MJD? And how you got to this field in the first place? All right, there's a question. Where's the hand?
So I can tell you for myself that, that my initial motivation, so why I was doing this, is out of interest in research, basically curiosity and wanting to learn. So nothing to do. I don't have any connection, even though I'm Portuguese. There's no connection to disease in my family. Actually, if I was to study my family's disorders, I should be studying cancer because lots of people in my family have died from cancer. So it was from curiosity. But then, of course, you start. I came to meetings in which I met patients also several times, and I think that has also changed my perspective. And we also become, in a way, responsible in that way. We feel that we have to get somewhere and get a reply. But I think it's also okay that people start by curiosity, just because you want to learn and understand how things work in the brain, for instance. It can still lead you to very good findings, even though you don't have a personal motivation to do this. But with time, I think all of us become also get this feeling of I have to find a solution for this and not drop this subject.
Thank you. Does anybody else want to provide a perspective?
Mario.
Good question. Well, it's not when I tell you a story, it's not a personal motivation, not only from myself, but from my whole team in Peru, and also for my mentor. And one of the reasons that we usually, let's put it this way, at least in Peru, what happens when you go to School of Medicine, most of the training you receive is to treat the most common disorders. So that's what physicians usually have in mind. And the other issue is that physicians have in mind is like they always have to have like knowledge to offer treatments to patients in terms of drugs or specific interventions, evidence-based interventions. But when you deal with rare disorders, the story is completely different. More than once, what happened with the general physician or that is not properly trained and doesn't have enough information about rare disorders, it's more than once common to say, well, there's no treatment. There's nothing to do, so sorry. And we really want to change that, not only in our center, but for the rest, for other generations of healthcare providers to think another way. And that's going to be, at least from our perspective, a big difference, not only for you, for patients and for family members, but also for the whole healthcare community, because our way of thinking should change as a community.
Thank you very much. I think in the interest of time, we probably will need to move on to some of the questions that have been posed by people in the room for the panel. And because I can't really move out from behind here and read it, one of the questions that has struck me as one that might be interesting for the panel to consider is whether or not people would participate in a clinical trial for the treatment of MJD, even if it would be very stressful and even if you would not know whether the approach has any effect. So the question to the panel is, would you be prepared to be part of a clinical trial, even if it would be a stressful experience and even if you would not know whether the approach would have any effect? Do any of our panel want to make a comment on that?
My comment is just I would participate in the clinical trial. For the past 4 years, I participated in research studies with Johns Hopkins, and they stuck me in the MRI. So for about 50 minutes, I got to hear the clicking. And not only was I in the MRI, but I had my head inside of one of those little helmets. And basically, I don't like to be confined to a small space, but I know that the research should be benefiting, more than just me. So a clinical trial, I understand that you need people with this disease to do your research and clinical trials. So I don't have a problem with it.
I am currently on a trial. Still, it's not going to last forever. But, and I'm really grateful as well for that trial that I'm doing it. I hope there is something coming out positive of this research. Otherwise, I wouldn't give myself as a guinea pig for...
or a zebrafish.
Yes. For this research.
Thank you.
I would just like to say that the answer is yes, because there's nothing more stressful than living with a condition, and given what's been said already, to live with a condition already, there is really anything, whatever the outcome, is much better than, as it was said by one of the presenters yesterday, but it's better than sitting there doing nothing. We have to do something, even if the outcome is not necessarily what we would hope in a clinical trial. But of course, yes, is the answer, because to do nothing is the impact on individuals already is incredibly stressful. You can't equate how stressful that is living with a condition.
So you feel that in some ways it's a form of progress just to be part of?
Absolutely. We have to give back to what we give. We're giving back something, so it's a two-way process. Everyone is so grateful to all of the scientists, everyone who's in research, anyone who's doing anything. We're grateful to do that, but it's a two-way process, and I think everybody involved with it recognises that and inputs that, and we're all. But it's a two-way process. But. So yeah, I think that it's about being brave as well, saying, look, there are people here that are ready to do that. They're already here, and they're willing to put themselves forward. And whilst the ethics, of course, have to be considered considerably, they've been considered in other areas, in other treatments and other interventions. If they can be done then, they can be done now. And there are cohorts here and individuals that are willing to do that.
Thank you. And I think just to, because we are starting to run short of time, one of the other questions that would be interesting for the room to consider, and we consider the nexus between the quality of life research we talked about and the laboratory science. The question that's jumping out at me is, which symptoms do you feel have the most impact on your quality of life? Because if we start to consider what's most important to you, people living with the disease, that becomes a very important prompt for the sorts of research that can be done to improve people's quality of life. So I don't know if anybody's happy to, Joyce even, would like to have a go at answering what symptoms have the most impact on your quality of life.
Lại các viên giáo viên mà nhung qua, cứ mình làm cho người dân các cũng nó mang cho các bạn trẻ nó mang người mang cho các bạn cứ nói bên nào cũng được, nói sao cũng, cái nãy là nghe có anh muốn cái tuổi sinh người dân.
In your life, with your MJD, what's the thing that really bothers you the most?
What's just doing that? All right.
Hello. Hello. What when I had this disease, MJD, I used to walk around with walking stick. Then after walking stick, then I've been walking around with the walker. Then after walker, then I'm still in wheelchair because I fell down and broke my ankle. But I'm still strong. And when my mama lied, I used to help cooking, cleaning up the house.
Yeah, is to help you or not?
Not only. She used to help her mom in the house, clean up, cook, and even help her father because her father had this disease before her, and she helped me a lot when she was a strong girl growing up, and she didn't even understand what this disease was he had. Then gradually, she had a partner, and she didn't even notice that she had that disease. Nobody knew, even I didn't know about it. Because I used to go out with her and push together, but I didn't know that she had this disease. But I thank God that each one of them knows what the disease is and what had happened, because we never ask each other. Even as me, in helping my families and even other people today, I do. Clients, they go first. I always go and sit and ask what their needs are. Then they tell me and stop and ask together. We do things to help the clients in the community, because both of us, we came a long way from home, from Australia, Rhode Island. We didn't come here just to sit here and listen to what everyone is going to say. But because we came all the way to share what's happening back at home. And you saw this picture of Bagala, and that's what she and the others and Bagala are looking for, that they would able to walk again like before. Thank you.
Thank you. And I think,
another response to that one around if we are to maybe take Laura's approach to start to put more investment in researching how to improve quality of life issues such as symptoms, what might we focus on? What's the most important symptoms that you might have that affect your quality of life?
Well, just like ladies at the end of the table, I believe walking is probably the most important symptom that I have. My mobility. It affects my work because I can't walk to my boss and hand him a sheet of paper that I've been working on. I have my scooter at work, so if I pick up my paper, I got to scooter it, to whoever I'm talking to. So, and even at home in my personal life, I don't cook as much because if I cut in the oven, if I have the oven door open, I had to be careful not to fall into the oven. So I think walking and my bodily balance is probably the most important of all my symptoms that I have.
Thank you.
I think for myself it will be the speech. Obviously, I speak 6 languages and a half, and I say this as a joke, 6 and a half, being the half of it Japanese. I can maintain a conversation with almost anybody in the world, but it's very daunting for me not be able to communicate. All inside of my head is perfectly organized, and the thoughts are okay, but when I'm going to try to express myself, I'll take too much time, and it's very empowering for me. A part, of course, of not being able to express myself better or as I want it to be.
Thank you very much. Thank you so much. Can everybody give that